I'm Dr. Alyssa Pittman, and I'm a breast surgical oncologist. Everyone who becomes a doctor kind of has this idea of going in and helping patients and creating this relationship with their patients and making an impact on them. And I think breast surgery is the perfect specialty for all of those things. You know, we get to take the patient to the operating room and remove that cancer, kind of give them relief from that anxiety that they're having. And that allows us to build that personal relationship. And I think breast surgery is just very rewarding for physicians. And that's kind of why I chose it based off of all the other surgical specialties. I am from Atlanta originally, and I went to the University of Georgia, so go Dogs. I then stayed in Georgia for my medical training at the Medical College of Georgia, and there I met my husband. We couples matched and went to go do our residency training together in Greenville, South Carolina. I completed the 5 years of residency there and then matched at West for Breast Surgical Oncology. And so my husband came with me, and he's one of the primary care doctors in Memphis as well. Margaret West Breast Center is a comprehensive breast center. So we have everything you would need for your breast cancer care here in the building, and everyone talks to each other and coordinates your care. Our imaging is done in-house. If you have a finding on your imaging, we immediately take you down the hallway and perform the biopsy to get you as quick of a result as possible. I think that, you know, having everybody in-house working together and knowing each other so well allows us to give that efficient care for our patients, get them to the operating room as soon as possible. I know that breast cancer diagnosis is something that, you know, somebody's at their lowest point in their life, and they want to know that they're being taken care of, and we can do that here at West with all the expert team that we have. We have a tumor board where we talk about all of our patients and, you know, make sure that we're doing up-to-date care for each patient. Breast tumor boards are once a week, and, you know, the medical oncologists, radiation oncology, pathology, radiology, the breast surgeons, we're all there. Your case is presented, and then the surgeons kind of say what their plan is, and the medical oncologists will tell their plan and how they coordinate those together, because one may happen before the other one in one case, but you may need to do surgery first in some instances. And so we like to coordinate that to make sure that everybody's on the same page, and we have breast-specific radiologists. All they do all day is look at breast imaging. They look at the mammograms, they look at the ultrasounds, they look at the MRIs. They are the ones that look at and compare the mammograms to your previous mammograms, as well as the MRI to the mammogram. And so since that's all that they're doing, they're very focused on identifying the lesions that need to be biopsied. And then we have the surgeon right down the hall. They can do the biopsy right then. They can also have the radiologist come down to the room and show them the specific lesion that they want to make sure that we're biopsying the thing that they found. And so the breast-specific radiologist just kind of enhances the ability to find those lesions earlier on mammogram. I interviewed at a lot of places for fellowship, and I really felt like West was a family. I got that even over Zoom as interviewing in COVID times, and that's kind of why I chose here to train. But when I got here, interacting, you know, with not only the staff but the patients, everybody was so nice and caring and loving. And it's not just between the staff in your department, it's staff, you know, upstairs in medical oncology or downstairs in radiation oncology. Everybody works as a team here to benefit our patients. And once you're a patient here, you kind of become part of that family.